Morning, everybody. Today I'm going to be talking about equity versus equality in healthcare. And what does it mean? I think that equity, there's pretty good evidence for this, that it's a term that's been co-opted in politics and activism, both on the left and the right. And so in a healthcare context, what is equity supposed to mean? In the NHS in England, we pay a small amount of tax every month, which goes towards the national insurance, which pays for our health service. It's effectively our health insurance. And that money gets put into a giant pot, which is given yearly to NHS England, and then they divvy up the money. They do all sorts of algorithms and statistics to figure out who we've got to pay money to, how the fund's going to be used. This is where equity is really important. If you went for basic equality, that would mean that everybody would get the same amount of money, or every condition or every hospital would get the same amount of money, or every primary care service would. But of course, as we know, different diseases have different prevalences, different groups of people have different risks and vulnerabilities, and so we need to figure out how best to spend that money. This is where equity comes in. For example, in research and funding, schizophrenia has traditionally received a disproportionate amount of attention and funding compared to how many people actually have the condition, and the effects of that condition socially. And anorexia and bulimia have had vastly less attention. They've received nowhere near enough funding or research attention than they should. This has been going on for decades. So you see that there's a lack of equity there. And yeah, so equity in a healthcare context is each condition or each hospital or service or each individual gets the money that they need insofar as that can be catered for within the health service. And obviously there's a finite amount of money. So I would say there's a lot of people, a lot of groups out there that don't get the funding that they probably should. But that's a different conversation. That's essentially what equity is.